Hello, I'm Tressa Springman. I'm the Chief Information Officer at LifeBridge Health in Maryland. I have responsibility for our IT and telecom teams, and also as a member of the Executive Management Group, also have oversight over our health information management function, as well as telehealth and our digital care center with associates in Israel, Manila, and here in the U.S.
Hello, I'm Rick Miller. I'm the Chief Information Security Officer here at LifeBridge Health, and I also oversee the Identity and Access Management program at LifeBridge as well. Identity security is super important to this organization. HIPAA relies on identity and security as well as a framework that LifeBridge strives to achieve towards, which is NIST. So it's a security control framework that prioritizes access control and identity and authorization. To be specific, it's very important that we have the right people authorizing the access within the organization, and that's really the primary way that our security function is supported.
Because of identity and security, we've been able to engage our entire workforce in a much better understanding about balancing access to information with our commitment to protecting it. And the actual implementation events to stand up a program like this really made visible blind spots that otherwise could have presented breach risks for the organization. Our software application portfolio in an organization of this size is hundreds and hundreds of different software applications, each of which we need to make sure are permissioned correctly for our physicians, our associates to be able to do their job safely and effectively. And that complexity can't be overstated. Until you're in the back office function of an IT team, you don't understand really the complexity that's involved in just granting access for a new employee coming on board, because there's such an algorithmic relationship of the unique number of systems that associate or provider may need in order to be successful. So you can either staff that behind the scenes with a lot of very valuable IT associates and assets and pray that the timing on that can be orchestrated elegantly and perfectly every time. And that in our organization is hundreds of times a week. Or you can rely upon a platform that automates the majority of it and allows our associates to be liberated to be doing work that's more appropriate for their skill set.
The right level of identity and security controls is something that a lot of organizations are challenged with, because there's a balance between needing to get the access right and get the access quickly. So getting the access right is something that we've been very focused on. It's important that employees that transition from one role to the other don't retain their access from the previous role when they move to the new role. In our program, we didn't do a great job of that without our Identity and Access Governance Management program. Once we stood that up and we've automated that between the HRIS system and between our Identity and Access Management platform, all of that has become very automated now, and we no longer have to concern ourselves with folks carrying over access that they shouldn't have when they transition to a new role, which actually happens quite frequently.
In healthcare, the one thing that this recent past has taught us is the only constant is change. And I feel very confident that the investment in our security and access management platform and program will be able to evolve as we evolve. The threats continue to change. They continue to become more sophisticated. And we've got to have capacity to put our resources on better problem solving for these new threats. And the security and access fundamental nature, if not addressed initially, really creates a barrier for us having capacity to lean into these new threats as they come about.